Bear with us on this because health officials have called revelations shocking, which of course they are, with some staff reporting nausea, and they've even had headaches, of course, as a result of that.
Well, meanwhile, the government say it is investing record sums to upgrade and modernise NHS buildings. So joining us now is the medical officer of BUPA, Dr. Andrew Vallance-Owen. Good morning to you, Doctor. Let's go into the sort of the technicalities of this, of the plumbing a bit later on. First of all, what are the hygiene and the medical case for what is happening at the moment? What are the dangers to not just the staff, but also to the patients of this happening?
Yeah, I mean, it really is a horrendous story, isn't it? And I mean, people expect their hospitals to be hygienic, to be clean, above all safe places. And of course, sewage, raw sewage, does contain negative bugs, E. coli particularly. So it is definitely unsafe to have raw sewage floating around, as you said. It's not quite as bad as that, but on the floors, in spaces around hospitals where you're expecting absolute cleanliness. I mean, even apparently some operating theatres have had some leaks. And I mean, I think just to add to your intro, only 53 trusts responded to the survey, which the Liberal Democrats did. So, the 450 places where there have been leaks is maybe quite a small part of the overall.
You're painting a picture here, Andrew, of a third world country, not United Kingdom. How does this happen? Is it blockages? Is it simply old hospitals crumbling? Is it outside and backing up? I mean, how's it actually happening in the first place is what I'm after.
Yeah, I debated using that phrase myself, third world country, but didn't use it. But a lot of very minor sewage things are blocked toilets, and that's very common in many public spaces, as we know. But I understand this is more than that. This is sewage on the floor. The staff have talked about slipping in it, and of course it's just awful for the staff working in those conditions as well. As if our nurses and frontline staff haven't got enough problems with the load on the National Health Service at the moment, without probably being asked to help to clean this up. Given the staffing shortages.